Hey, hello and welcome. This Comcare webinar, Why Recovery and Return to Work Matters and What Makes a Difference. My name's Andrew Crane. I'm the Acting Director of Comcare's Education and Engagement team, and I'll be your host for today's event. So I really want to acknowledge again all of you who are present for making the time to come along and attend the webinar and participate in it today. It's a really important subject. Feedback from Comcare's employer survey and some general feedback that we've received has certainly helped to shape the session that we've got today. On your screen, also now's your first poll question. We're really keen to see if you've had experience directly with work-related injury or illness and return to work, and what sort of capacity, whether it's you as an employee, as a rehab case manager, if you've been a supervisor or a manager, etc. So pop your responses in there. And while you do that, I'll give a brief overview of today's program. So first up in today's session, we've got Mick Duke, the General Manager of Comcare's Scheme Management Group, who's going to be providing an overview of why return to work matters, an update on the latest data and insights on return to work across the Comcare scheme. Following that, we have a panel of high-quality speakers for you today who are going to be offering a range of perspectives and insights in the process of recovery and return to work following somebody's work-related injury or illness. And today's panel will include, we've got Peter Kirwan from New South Wales Fire and Rescue, who's got a lived experience of return to work and recovery through work following a workplace injury. We've got Tim Saunders, a Health Management and Rehabilitation Manager from Telstra. We've got Dr. Catherine Kelaher, an occupational physician, general practitioner with extensive experience as a treating health practitioner and supporting employees returning to work following a workplace injury and illness. But now, without further ado, we might actually have a quick look at those that data that's come through from the poll. And it looks like we've got a lot of case managers, which is terrific in here. We've got supervisors, senior managers, which is fantastic, a number of health professionals. We've got rehab providers, which is great, some employees, which is fantastic of you being here with an interest. And so now I'll pass over to Mick to provide you some information around our scheme. Welcome, Mick.
Thanks, Andrew, and welcome everyone. It's great to see such an eclectic group come along today to discuss the issues around return to work and why it really matters. So as Andrew sort of highlighted, I think a couple of key messages from my session today will be the focus on the health benefits of good work, the importance of a supervisor making early contact with an employee who is ill or injured, the benefits but also the challenges of return to work following a work-related injury, and what are some of the practices that create a workplace culture that supports employees to return to work. I've also got a little poll that's going to pop up in a minute for you all. So the question I'm asking is, what do you think is the most important element in supporting recovery and return to work? You could just put your answer in and submit it. It'll come up as a word cloud. So a lot coming through around early support, communication, support from manager. I can see clear goals and effective communication again. So this is all really positive because obviously both early support, but equally that clear communication is a real integral part to a positive return to work journey for an individual. So thanks for putting those through. I'll move on and just talk a little bit about a background, I guess, to help illustrate why I think supporting return to work is so important. So look, at the start, I'm going to say for an individual, the health benefits of work have been well researched. We can confidently say that good work is good for you, and returning to work following an injury or illness has actually been shown to be beneficial for a person's recovery. So we see this in our scheme when we look at some of the results from our National Return to Work Survey. Our survey revealed that 58% of employees with a mental illness said that returning to work actually improved their recovery, so more than half. And actually 93% of employees took up the option of modified or alternative duties when they were offered. So from an individual, returning to work actually helps them on a number of levels. It helps the individual gain financial stability, maintains a sense of routine and purpose. It helps foster social connections, which are so important. All of these things contribute to a better well-being, but in particular, a better mental health as well. I think the benefits from an organisation are probably pretty well known, but let's just touch on them. Obviously, for an organisation, return to work improves productivity. It's also likely to achieve higher staff morale and continuity of business operations, all of which are important. There are the obvious financial reasons why at an organisation return to work matters. We know that a key driver in our scheme in particular is costs associated with payment for time off work, or incapacity payments as we call them. In our scheme, payments can continue for decades out into retirement age, which is 67 at the moment, while other payments, such as medical, can last for a lifetime. Currently in our scheme, there are about 1,900, this is just in the Commonwealth side of the scheme, in fact. There are about 1,900 employees or ex-employees in receipt of incapacity benefits. In any 1 year, the total of accepted incapacity weeks for Commonwealth agencies added up to approximately 1,700 people off work for the entire year. So those numbers are pretty stark. When you put them into perspective, that number of people off work would be enough to fully staff multiple mid-size agencies. In essence, you could staff approximately 3 Comcares for an entire year with that number of people off work. I think why return to work matters is also important from a broader community perspective. Return to work plays a key role in boosting economic productivity, but also reducing the dependency on social support systems, because we know people travel through the various social support systems. Depression and anxiety has actually been estimated to cost the global economy US $1 trillion each year, driven predominantly by the loss in productivity. We might look now to some of the trends in our scheme, and we look in relation to the incidence of accepted claims over the past 6 years. What we can see here is that the incidence of accepted claims, which is on the left-hand side, has remained relatively stable over time. But we compare this to the incidence of accepted psychological claims on the right. We note that psychological injury claims are on the rise in our scheme. And our scheme's not unique here. Most schemes across the country are experiencing a similar trend, if not more pronounced. Taking a look now at return to work and the trends in return to work over the same period, what we could see here is sorry, I've just lost my spot. So return to work trends over the same period in the scheme. We see on the left-hand side, really good return to work rates, something like 90% across all injury types. And this is really pleasing to see such a consistently high return to work rate. However, it's less pleasing to note that for employees with psychological injuries, we notice a much lower overall return to work rate, and a slight decrease in return to work rate over time is being observed. We know that in recent years in the Comcare scheme, psychological injury costs have also risen, with those suffering from psychological injuries having more time off work and poorer return to work outcomes than those who have physical injury or physical disease claims. So the obvious question is, what can we do about this? So again, I'll theme this up at an organisational level. From the perspective of the organisation, we can consider a few things. Firstly, empowering the employee. Employee empowerment, and I was pleased to see that come up before in the word cloud, is in the context of return to work refers to giving the employee the authority, responsibility, and the resources to actively participate in the process of returning to work after an illness or injury. This involves providing employees with information and the autonomy to make decisions related to their own return to work, accommodating their needs and fostering a supportive environment for a successful transition back to work. Getting your resourcing right, ensuring that all key people involved in the workplace injury management, including supervisors, rehab case managers, return to work coordinators, senior management even, have the resources and support that they need to positively impact on those outcomes. That's really about the capability in your people who are in that return to work journey with the injured employee. Acting early, again, this was another thing that came through the word cloud. Early intervention in the return to work process is crucial. Providing support as early as possible and taking a proactive approach helps prevent prolonged absences. Research has shown that making early contact with the injured employee, i.e. within the first 3 days, results in a 26% higher return to work rate for physical claims. But here's where the kicker is, a 45% increase for psychological claims. So it's important to really note what are we talking about in terms of who should be making contact. It's really important that the focus there is on the line supervisors. That is where the difference is made. So it's not necessarily the HR people or the rehab case managers, it's the supervisors that make the real difference. Organisations can also look at measuring and monitoring return to work, and this is essential for a couple of reasons. It provides insight into the effectiveness of rehabilitation programs and approaches. It identifies potential barriers to successful recovery, and it helps assess the overall well-being of employees. Measuring and monitoring should happen at all levels. The last thing to touch on is workplace culture. Excuse me. We know that the way an employee is treated and responded to by their employer is critical in determining the return to work outcome. Employees who consider that their employer's response to their injury is fair and constructive are considerably more likely to return to work than those who don't perceive that. When workers' compensation is destigmatised and return to work efforts are approached with empathy and support from leadership, it results in a more positive and productive workplace culture, something that we're all striving for. As one example, employees who were not concerned about making a claim were 3.1 times more likely to return to work. The last bit I'd like to touch on was really, so how can we help? How can we at Comcare help? At Comcare, our purpose is obviously to promote and enable safe and healthy work. In a recovery and a return to work context, we seek to promote better practice return to work strategies and work with our stakeholders to enable a timely, safe and durable return to work. Some of the examples of how we can help include the return to work guidance, and this includes our rehabilitation case manager handbook. This has been downloaded approximately 1,400 times a year and provides rehab case managers, of which there's a number of you here today, with all the essential information to perform their role and support employees in their recovery. We also run our rehab case manager forums, and these occur at least 3 times a year and bring together experts from across the country and a variety of roles to discuss better practice and practical tips to support employees. A community of practice of like-minded individuals, if you will, where you can all link into better practice initiatives. I'd also draw your attention to our return to work videos, which were recently launched last year. These provide the basics of return to work for employees and supervisors in an easy to consume format. To ensure employees have access to providers who are appropriately skilled and can support their recovery, we also maintain an approved panel of workplace rehabilitation providers. that the scheme participants can access if needed. Obviously, you can also reach out to our teams at Comcare who can assist with you and advise on a whole range of matters relating to rehabilitation policy, our legislation, as well as better practice in provider management and return to work. I'll put up another poll now and just broadly seek some views about what additional support or guidance would assist you in influencing recovery and return to work. So again, we're getting some good forums for webinars and forums, and that's indeed the purpose of our forum today, but also case conferencing appears to be a popular one as well. So we're drawing to a close on my presentation, and we will pop a few of the additional return to work resources that we have available in the chat for you all to refer to. In closing, I really do hope that you find this webinar to be another worthwhile and useful resource to assist with the improving of return to work practices within your organisation. Again, another great opportunity to connect with peers. I'll hand back now to Andrew and look forward to continuing the webinar and seeing what others have to say. Thanks, Andrew.
Great. Thanks, Mick. And now for part of the webinar that I hope you've been waiting for, where our guest speakers, who I'll introduce in a moment, will join us for a panel session, and we'll look to address some of the questions that you as the audience have put forward through the registration process. So first, we've got Peter Kirwan, who's a firefighter with Fire and Rescue New South Wales, whose story of illness and injury recovery has been showcased through the Black Dog Institute and viewed over 100,000 times. Peter was a Black Dog Institute presenter and worked with a range of other organisations, sharing insights from his own lived experience of being involved in a major workplace accident, the impact on his physical and mental health, and the challenges that he faced in recovering at work and through work. We've also got Tim Saunders, who leads Telstra's health management and rehabilitation team, who provide early intervention, return to work consultation and rehabilitation support to Telstra's 25,000 plus diverse workforce that ranges across both domestic and international environments. Tim's got a background as a physiotherapist and is passionate about helping people to make optimum recovery from injury or illness, and sees the unquestionable impact of good work that it makes in achieving a successful rehabilitation long-term goal. Tim and his team's ways of working demonstrate a person-centric, evidence-based and innovative data-driven methods which have demonstrated consistent positive outcomes for Telstra's people and business. And Tim, with the team at Telstra, recently received a National Health and Safety Award in the Recovery and Return to Work category for their work transition program. And Tim individually received a High Commendation Award and the same awards, recognising his making exceptional difference to the workplace and exceeding his normal workplace duties. We've got Dr. Catherine Kelaher, who's a fellow at the Australian Faculty of Occupational Environmental Medicine, also the Royal Australian College of General Practitioners. Catherine, or Kath, worked with the Department of Health through COVID-19 pandemic to help organisations to optimally manage the risk related to SARS-CoV-2. And she's Senior Occupational Environmental Physician with Defence, working to optimise the health and wellbeing of ADF members. Kath understands the importance of supporting people to stay and return to work. So to get us started, I want to welcome the panel. I'm sure cameras are all on, which is great. Good to see you there. And we might start with Peter. If you could tell us a bit about your background and experience with work-related injury and return to work.
Thanks, Andrew. So I started with Fire and Rescue New South Wales in 1992. And in 2003, I was responding to a motor vehicle collision in Sydney and was myself involved in a motor vehicle collision. That had me transported to hospital. About 12 months later, at work, I had an acute injury to my back as a result of that initial accident and started really in the workers' compensation system and started living with chronic pain as well due to my back injury. some time later, a few years later, I had a psychological claim created. I had a breakdown at work, partly because of chronic pain, partly due to other workplace factors, and again entered into that workers' compensation system. And I wasn't prepared for that journey that I embarked on. The physical journey was sort of one side of it, but the psychological journey in that claim was significantly different. There was less stigma around the physical injury than there was about the psychological injury. I was more aware of what treatment options were for a physical injury rather than a psychological injury. And my understanding of the psychological treatment options it's based on television. You know, my perceptions of what a psychiatrist is based on television, which isn't necessarily accurate. So I wasn't prepared for that journey, and I think that journey was more stressful for me than the journey I went on with my physical injury, with my back injury.
Yeah, thanks, and thanks for sharing your story. It's very impactful. Tough journey.
Thanks.
Kath, would you like to share a little?
Thanks, Andrew, and thanks, everybody. It's great to be here. So I've worked as a GP and an occupational physician in civilian, defence, other government agencies, working both to protect and prevent worker injury, but also in managing worker injury and returning people to work. So from the whole spectrum at the beginning of injury to even undertaking, independent assessments of people's injuries, but I've seen, the whole array of management, from very, very good management to the absolute other end of the spectrum. So I've got experience in all of those cases, not Peter's first-hand experience, but I've had a lot of patients who've had similar pathways. Thanks, Andrew.
Tim?
Thanks, Andrew, and good morning, everyone. It's great to be here with you today. My name is Tim. I lead the health management and rehab team at Telstra. By trade, I'm a registered physiotherapist, and prior to joining Telstra, I spent over a decade working in the private practice sectors in Melbourne, where I'm from. At Telstra, my passionate team and I, we support our 25,000 plus employees all across Australia and also internationally to recover at work and also return to work following an injury or illness. And we also provide our people who require reasonable adjustments due to a disability to stay at work as well. We provide the same level of rehab support regardless of causation. So which means, for example, if someone injured their shoulder lifting a ladder out in the field, or they're recovering from a personal illness sort of outside of work and trying to recover at work, they get offered the same support at Telstra. And we wholeheartedly believe in the powerful impact that good work makes to people. What Mick was saying before obviously resonates very strongly with us and what we do, and I'll probably look forward to talking to that a little bit more later on. But we're really passionate about sort of creating those inclusive, person-centric, empowering pathways for people to return to work. And in doing so, we've seen the incredible human and also financial and business outcomes that you can get from when all those aspects really come together. So yeah, thrilled to be on this panel with Kath and Pete, and looking forward to sharing my experience from an employee's perspective of that pivotal role in helping someone return to work.
Yeah, thanks, Tim. And so we might start again with you, Kath, for this one, which is around your perspective on why does return to work and recovery through work matter?
Yeah, thanks, Andrew. And I'm probably going to cover off of some of the points that Mick has already made and Tim has just made, because it really matters, because there are significant adverse impacts to the individual and society, and also to the employer, with delayed recovery and delayed return to work. It can lead to long-term worklessness, and barriers to prompt recovery can have long-term consequences. The longer a person's away from work, the less likely it is that they will return to work. And there are also substantial negative impacts associated with the long-term worklessness, including poorer physical and psychological health, financial distress, higher rates of many, many other health conditions. And there are intergenerational and community impacts as well. So over time, people who've had difficult return to work processes or claim processes instigate this negative cascade of in their life, and isolation, frustration, strained or broken relationships are common of people who get stuck into the system. And the children of people who have experiencing persistent worklessness have higher rates of distress, poorer mental health than children in the general population. And the longer term claims, there's often family pressure, family breakdown, financial distress, and lives are significantly impacted. And that's particularly important in compensation settings where outcomes are actually even poorer. It's about 4 times higher, I think, as Mick said, as the same condition without compensation. And this is for all health conditions, and it's even higher in psychological injuries. And there are obviously flow-on financial costs for employers and taxpayers, and the worker themselves. So I'll leave that there. Mick's covered some of that other ground already. Thanks, Andrew.
No problem. Tim?
I might just add, I think from an employer's perspective, it's really quite simple, being like, why does recovery and return to work matter? Because increased employees' health equals increased capacity to be productive equals better business outcomes. So whether you look at it from a care-based or a human perspective, or you look at it from, say, a business or commercial perspective, there are countless benefits to good return to work or recovery. I guess it's just depending on what hat you're wearing or where you sit in the business. Ultimately, supporting that person to return to work is going to give you the same benefit. I mean, as Mick spoke to before, there's compelling evidence for organisations to embed these integrated approaches to health and wellbeing into the business. I just might quickly touch on just a couple that we sort of live sort of day by day. But I mean, Kath also just spoke to it, but the research is quite overwhelming that people who are in good work tend to enjoy happier and healthier lives than those not in work. And generally speaking, that people's physical and mental health will improve from involvement in good work. They recover from sickness quicker. They basically build more resilience for anything that goes on outside of work better. And because of these recognised benefits for health, like we certainly as an employer or a return to work sort of function or rehab case management function, we strongly recommend, and we're always pitching the benefits of good work to managers, supervisors, new or old, to help people stay at work or remain at work throughout their recovery or return to work. Often when they go home and rest or go take a week or two off can sometimes be more harmful and good in some circumstances. Of course, there's some medical conditions that necessitate that, and that's absolutely appropriate. But a lot of the time, keeping people engaged or motivated to stay at work has a really good benefit. And I'll just quickly also add, sorry, Pete, before we jump to you, is just that from a business perspective, if you've got your CFO hat on for a second, that there's indirect and direct financial benefits from having someone remain at work. The evidence strongly suggests that more engaged employees are more likely to adapt to changing business needs and more resilient with their work that comes through. They can be more productive. That resilience instills, that the good work instills, can be quite protective against other factors, and they become more productive. And then the direct financial cost is sort of quite obvious in the sense that less time off, less absenteeism, less sick leave, less people you need to cover those that are sick in that sense. And the research shows that it's a 2 to 3 to 1 at worst benefit of cost spent on return to work versus the benefit you get from return to work. So from a financial perspective, it's almost a no-brainer having return to work systems in place. And again, that's at Telstra why we support non-work and work-related conditions just the same, because of all those non-compensation benefits, but everything else in that sense too.
Thanks. And Peter, would you like to talk about why return to work and recovery through work matters from your perspective?
So for me, when I had my back injury, I had a week off. One of the things that I found when I was not at work, and it was only for 5 days, even though I'm now on permanent light duties because of that injury, was that my home is not set up for someone with a back injury. And I would do things that would aggravate my back injury. So just sitting on a lounge, for example, aggravated my back injury and increased my discomfort and pain. And then you do all those other jobs as well. So that's one part of it. My psychological claim, I was given 1 day off. I was in an incredibly supportive environment, and I was encouraged to return to work after 1 day. But it's about those social connections and routine as well. It is so easy not to get up out of bed, especially with a psychological claim. So if you have a routine and you can maintain a routine in a psychologically safe workplace, it does keep you engaged. And from my perspective, I think that's one of the things that sort of led me down the path to how I'm here now, by being engaged and being able to talk about it and being able to have bad days at work. So social interactions, I think, is just so important. And I think too, the longer I spent 10 months on alternate duties in a separate directorate to where I normally worked, that was awkward enough going back to my regular work team at the end of that 10 months. And I think if I had been at home for 10 months, it would have just been almost impossible.
Yeah, and there's a lot of evidence that say the longer that you're away, the harder it is to come back. So you're right about that feeling impossible once that gap has been sort of established. So again, we might start off with you again, Kath. So based around your experience, what are some of the challenges or barriers for return to work and recovery through work that you've witnessed or experienced?
Thanks, Andrew. Look, I have to say, I think the biggest problem, biggest barriers are unmanaged psychosocial risks. So workers exposed to high levels of psychosocial risk have about 3 times the number of days off work as those with low risk. And the more psychosocial risk factors a worker is exposed to, the more likely that their recovery will be delayed. So as the number of these psychosocial risks increase, so too does the probability that the worker will not recover from their injury or illness or will have a delayed recovery. And those sort of things I'm talking about are, personal factors such as the low coping ability, fear of re-injury and other health conditions. They're systematic psychosocial factors. So perceived or real unfairness in the system or poor stakeholder engagement, i.e. with the medical provider or with work, case management issues such as delays or poor communication, workplace issues such as lack of support or communication, poorly modified duties, and obviously healthcare psychosocial factors such as lack of engagement with specific work issues and return to work in a non-collaborative approach. So those are the main things, I think. Thank you.
We might keep going the same circle again. Tim, your thoughts on barriers and challenges in the space?
I'd have to completely agree with Kath. Like we see that play out quite frequently. And at Telstra, we have quite a diverse work environment that we have people out in the field, sort of manual labourers, if you will, laying fibre, digging trenches, lifting heavy pit lids, climbing towers, doing a lot of physical sort of manual handling hazards. But we also have a massive workforce contingent that's in the retail space or call centre space, and they're exposed to a significant number of psychosocial sort of risk factors too. So I just that resonated with me too, Kath. I guess a couple of things that I've seen sort of play out in terms of challenges for return to work. We talked about before about the health benefits of good work and how it's crucial that work is meaningful and productive for people to engage with. But it's no different when providing suitable duties or lighter duties to someone who's making a return to work. That it's not good work to give someone that may suit their medical capacity, sure, but the duties are ad hoc. They don't provide a lot of value to the business. They are essentially sorting paper clips or something that's sort of very irrelevant to that person. It doesn't challenge them from a mental sort of cognitive capacity. Might be all very well and safe and cotton ball and that sort of stuff, but that is not what good work is all about. Good work is about something that is consulted with the employee about. They should have a say on what their suitable duties should look like. How does those suitable duties impact on what their performance targets are like, or what they're trying to achieve for their year-long goals and these sorts of things? It shouldn't be too much different to just general good work in the workplace. I know we often hear from a lot of employers when they sort of feel like they're a bit stuck about someone's got a significant number of restrictions and they don't know how to find suitable duties that fit the specific medical criteria for that person. I guess on the flip side of that is we've talked about before, and Pete called it out, that if you give them nothing, they're going to be at home. They're going to be isolated. They're probably going to get worse. And you said too, Andrew, the research shows the longer you're off work, the less chance you've got of coming back. So working really hard and consulting your employee, working with your workplace rehab provider who will facilitate with the medical staff, people like Kath, people who, independent medical examiners, their GP, their own psychologist, about let's brainstorm what suitable duties look like. And they're really constructive duties. I think it's just absolutely critical. And I guess it's the other one that we've seen quite often as well, maybe not so much anymore because we're working hard on it, is that one of the main criteria, or I guess the main barriers to a successful return to work, is that direct relationship that someone has with their direct supervisor. And if that relationship breaks down, we know it's going to be a very challenging circumstance to help someone get back to work. So identifying that early, if there's a breakdown in communication, a breakdown in trust, relationship between the two parties, it's really imperative that tries to be managed, supported by other people around the business as much as possible in the first instance. So we certainly try and identify that early and do what we can about it. But I guess the main takeaway from me is the risk of doing nothing, as opposed to supporting someone in suitable duties, is probably the biggest thing that we're certainly trying to work on.
Yeah, thanks. And Peter, I'd love to hear your thoughts on some of those barriers and challenges.
I was just going to say that Tim just took about all my speaking points because I totally agree with what he said. I think work is such a big part of our identity. We spend somewhere between 7 and 15 hours a day at work, depending on how hard you work and where you work in the industry you're in and all those types of things. So it is a big part of work. And then, so to change someone's identity, even temporarily, by putting them in alternate or modified, or whatever term we're going to use, duties, is a tricky thing to do, because it does have to be meaningful, it does have to be appropriate, it does have to be engaging. And I think there needs to be some flexibility, and we're talking about those relationships, and having the injured worker be able to say, this isn't working out for me, these duties aren't working out for me, and be able to pivot as an organisation to give them something else meaningful is incredibly important, because people need to feel valued. And if you sit them in the corner counting paper clips, they're not going to feel valued. You're going to end up with presenteeism even. So alternate duties or modified duties are going to be really, really important, and especially if it's a long-term injury. For me as a frontline firefighter, when I was put on light duties and I had to find a permanent job because I was now permanently incapacitated, permanently unable to go back on a fire truck. But there's barriers to that as well. So what can I do? What processes do you have in place to try and find someone meaningful, long-term or permanent modified duties to keep them engaged? So that was quite difficult for me. And sometimes that, when you're in the process, can feel adversarial. And I think return to work people and managers need to understand that people want to get back to work. Most people want to get back to work. And sometimes in their own best interest, things have to be delayed back to their permanent job. And so there can be that adversarial feeling to it sometimes. And the only other thing is the injured party, the injured worker, and it certainly was for me, it feels incredibly frustrated not being able to do what they want to do. And sometimes that frustration can be misdirected, and if we're not conscious of it, we're not accepting of it, that can break down the relationship between all the interested parties, and that's detrimental to the return to work journey.
Yeah, thanks, Peter. I think I found just then some really profound and deep insights around that, a challenge to your identity and the reframed identity of either being an injury or the change to what your capacity is can have that really big impact. So thanks. And I've got another question for you then, which is, what can an employer then do to promote that positive workplace culture around recovery and return to work, and supporting employees to feel empowered in their rehabilitation rather than being disempowered in the process?
I think for my psychological claim, I already had a relationship with our health and safety branch. So there was a degree of trust there already, and they weren't faceless. So I think that the return to work group in the organisation needs to be proactive in getting out there and amongst the people. And I know that's not necessarily physically possible in some cases, but it's certainly virtually possible. So we can get people online, we can do internal webinars, we can do, work conferences and all that type of stuff. And there can be newsletters and bios and put a face to the return to work people, and then sell the product. To sell the return to work product, sell the benefits, and it has to be tailored to the industry. It's in a webinar with a whole pile of return to work professionals, it's going to look different than it will be to a whole pile of blue collar workers, and the benefits of return to work and stuff. The statistics may not be as financial statistics may not be as beneficial in that space as it would be in this space. So a tailored educational program, change the culture, and have return to work people that are human, that people can see and have sort of interacted with along the way previously, even virtually.
Thanks. Kath, your thoughts around promoting that positive workplace culture?
Yeah, thanks. So the positive workplace culture is really important, obviously, and I think potentially just don't wait until someone's returning to work to establish that. Let's try and develop the positive workplace culture in advance and take the pulse of how everything's going. But with regard empowering, let workers play a leading role in their recovering, make health of workers a priority, develop a program which is based on the needs of the individual and proactively manage their psychosocial risk by providing appropriate support, real collaboration, regular engagement, demonstrate fairness and leadership in the process, obviously ensure there are no unnecessary barriers to return to work rehabilitation, and encourage those positive psychosocial factors, those known to assist recovery and return to work while reducing negative psychosocial factors, and develop an approach which involves constructive engagement, collaboration, fairness and respect, care for the whole person, the individual, and take the organisational responsibility, informed by up-to-date evidence. Thanks.
And Tim, you might like to weigh on this as well around promoting that positive workplace culture, but I'll also get you to talk to us about any advice that you might want to give to a supervisor or a manager in this process, because they can feel a bit intimidated and daunted by the process, can't they?
Absolutely, yeah, and that's what I touched on before, that a lot of the diverse workforce that we have at Telstra, and I'm sure it's quite common across everyone here on the call, is varied in terms of tenure. We have people who've been here 30 years, but we have a significant portion of our business, particularly in the retail or call centre environments, that have been at Telstra less than a year and quite young. Some of them might be just teenagers. In that sense, and some of their managers might be very fresh to being a manager too. So I've certainly got probably a couple of things to say about that. I just on the thing about promoting positive workplace culture, Pete and Kath touched on it perfectly already. Maybe the only other thing to add is that there's just so many tools available for a manager to gather some talking points, or sort of like a how-to, if you will, to have that conversation with their employees. I know that we often get a lot of, it's almost people being a little bit fearful about having a conversation about health, because people do genuinely care, but they may be concerned about saying the wrong thing that might trigger some symptoms, or say the wrong thing that could cause someone to be feeling pressured or not engaged in the workforce. So I think just a bit of a shameless plug for Comcare. Comcare's obviously just released, and we've just had a good look at it at Telstra. We love it. Some really good resources on creating a safe and healthy workplace. And I reckon start there, because there's a few talking guides as how to do mental notes, and they're really, really specific sort of things that you can say and prepare yourself when you're having conversations around health in the workplace. And I think by doing that, allowing yourself as a manager to be in a good place to have that conversation is one of the best things you can do to promote sort of a positive culture. One of the other things that we promote as well, and it goes to creating a positive culture, but it also goes to, I believe, supporting someone to recover, is that, and we do it in our team, and it's sort of starting to become a little bit of a thing across Telstra, is that when we set our objectives or key results, we call them OKRs, people might call them KPIs or performance indicators, whatever you will, across the business. Our number one objective and key result is a health and well-being objective. So, it's not sales targets, it's not, well, for our team, it's not return to work rates or anything like that. The number one thing is looking after yourself and how you go about it. I would strongly recommend everyone to have their own health and well-being objective and key result. And I think that sort of promoting that culture that is the most important thing across your organisation sort of speaks volumes. I might just give you a quick example of what my personal one is, if you want to get some inspiration. For me, my objective, my personal wellbeing OKR is as follows: improve my overall health and wellbeing this year so I can thrive at Telstra. And the key things I have to do to achieve my own number one OKR for my performance review is essentially go for a walk or run 5 times per week, donate lunch at my desk 4 or 5 times, take at least 3 meetings walking outside instead of at my desk, and I've got a few more. They seem quite basic and that's a bit hilarious for an objective, but I think setting that sort of tone is really, really important. So that's probably one tip. In terms of new supervisors and new managers, and I said at Telstra we have hundreds, if not thousands, of new managers at Telstra, sort of on a year-by-year basis. I said often the thing that they're nervous about is saying the wrong thing. But I guess what I'll implore people to do, probably in the slogan of Are You OK Day, which is being here to hear. All your role really is as a manager is not to make assumptions. It's not even to solve the person's problem or health condition. It's just to try and understand. You don't need to provide advice. You don't need to do anything rash. All you need to do is be able to absorb what they're telling you and try and help them and yourself be empowered to come up with a solution. At Telstra, we had a conference last year and we're lucky enough to hear Kirk Docker speak. I don't know if everyone knows Kirk, but he runs an AB TV show, or hosts an AB TV show called You Can't Ask That. And he presented to us about listening to understand. And he interviewed and spoke to some of the most vulnerable people across all of Australia, and they were able to tell their story in a circumstance where probably they would be very, very caged off type individuals. And his takeaway was just listen to understand. Don't provide advice, just be curious. I think having that ability to, as a supervisor, particularly new supervisor, is take away the paradigm that you need to solve a problem. You just need to listen and understand what's going on in the workplace, and that will have insurmountable benefits to helping that person feel trusting and confident that they can have an optimal return to work. That's probably my key takeaway for new managers.
That's great. Thanks, Tim. Kath?
Yeah, thanks. And thanks, Tim. Look, I 100% agree. I think communication is one of the most important things you can do. And it's been shown time and time again that early empathetic communication with your injured worker makes a big difference. And it's, I'm going to add to what Tim said. It's not necessarily just about understanding, but it's demonstrating that you care about this person. And I think that's one of the most important things. You need to show that you do care about their person and their well-being. It's not just, when are you coming back to work, or, what's going on. It's really, we care about you. We're checking in to see that you're okay. You're basically demonstrating that you care for them. And I think that's really important. And, in addition to that, I would add again, identify any barriers to return to work and manage those with that person. Communicate not just with the person, that's obviously a priority, but also with the rehab provider and the medical provider, if that's in the scope. The regular communication is just so important in ensuring that the person has the right approach for them. Of course, it's an individual approach. Everybody's different. Every workplace is different. Every work role is different, and it's important to consider those differences. Monitor and track how they're doing, but in an empathetic, caring way that's, as Tim said, focused on the health and well-being of that person. Not we want to get you back into that full role as soon as possibly can, but we want you to be well and functioning and happy and healthy. Make sure your reviews are fair. The process is fair and transparent, and wherever possible, get that person to recover at work.
Thanks. And just to lead into that again, Kath, do you see many managers and supervisors kind of leaning into the process, or do they tend to sort of stand back off the process once it's become medicalised?
Yeah, look, I think it really varies. And I think going with Peter's experience, if there's a mental health issue, they do tend to stand back there. I don't know that it's because there's stigma associated with the mental health issue. I think it's because they're afraid of doing or saying the wrong thing in many cases. I think that's what it is. I think they're more prepared to be more engaged in a physical issue because they feel more comfortable about approaching it. But I think more engagement on the whole would be good, but it does need to be the right engagement. It needs to be with that care, understanding approach rather than I need to know what's happening. When are you coming? You just need to demonstrate that you caring about their well-being. Yeah.
Yeah, that's the primary concern. Yeah,
yep.
Is where it's coming from. Yeah, thank you. Peter, your thoughts on managers and supervisors, tips for how they can support?
The empathy is so important, and if you don't have those established relationships with the people that you're leading prior to the workplace injury, you're going to struggle. If you don't have respect for them and they don't have respect for you when the injury occurs, you're going to be in a really awkward position, and trying to engage with empathy at that point, not going to work. It's not going to seem genuine. So it's about having workplace relationships, and we know we're not always going to be friends, but if you are genuinely coming from a good place and you do happen to say the wrong thing, especially in a psychological claim, most of the time in my experience, people are okay about it if it's a genuine mistake and you're actually coming from a place of genuine empathy. If you're not and you say the wrong thing, it's not going to be perceived the same way. So empathy and develop relationships, and be a leader before the injury happens, not just a manager.
I just might add quickly to that, Andrew, as I saw a couple of questions in the chat come through about, I know we've got a lot of rehab case managers on the call. What can rehab case managers do to support this sort of positive workplace culture when oftentimes they're removed from the direct business unit, which is essentially my team? So we have 10 rehab case managers at Telstra that do just this. A lot of what we do is business partnering. So I think it's really critical that when you're having those first conversations with managers, particularly new managers, that a lot of that conversation is asking them how comfortable they are to have that conversation with their staff member. What resources do they have to also support themselves? Whether they need their own EAP call, they could call EAP. I'm not sure many organisations would have EAP specifically designed for leaders that we do at Telstra, but identifying when they might have not be able to ask the right questions, not being able to ask, what do you need from me, and have these sort of early conversations is critical for the manager, as it is critical for the manager to have with their employee as well. And I think as a rehab case manager, you have that real ability to sort of step back a little bit, quite objective in the process, in that sense that you can really analyse what's sort of happening around you and try and pick out where there's a little bit of conflict over here and we need to manage that straight away. And there's a little bit of inconsistent medical evidence, we need some further support, or let the employee take a little bit more almost control in getting their own advice to bring back to us, as opposed to directing them what to go and do. And I feel that sort of ability to facilitate and coordinate, see the bigger picture, is pretty critical from an RCM perspective.
Thanks, Tim. And we are approaching time, but there's been some questions come in through the chat, and we did have one in registration, which was around psychological injury and mental health challenges and around stigma. And I wonder if, Kath, you wanted to mention at all about dealing with that stigma when it comes to psychological injuries, and any sort of strategies, approaches, or ideas around that space.
Yeah, look, I mean, these can be much more difficult to manage because people are afraid, and I think it is really, as Peter said, people are afraid of doing and saying the wrong thing, and so they may not reach out as early as they should. And so I think reaching out very early, if you're uncomfortable doing that, use your rehabilitation case manager. You guys on the line have expertise in this area, and you can help build that relationship across the medical provider, the individual, and the employer. And I think establishing lines of communication is super important. As Peter said, a step for the employer, getting to know your workers before these things happen is essential. You can prevent these issues ultimately, you know, like, because people have things that happen in their lives that are stressful and affect their well-being, and it's not related to work, but it can become a work issue if you let it go. For example, you know, somebody starts coming in late or being absent, or their work quality goes down, it becomes a performance issue rather than, you know, than an issue that can be managed. If there's early engagement in the workplace, you could prevent a psychological issue. So I think prevention is better than cure. Early engagement, if an employer is uncomfortable, then the RCM plays a really important role in communicating to all of the stakeholders engaged, and it's important to have everybody engaged with constant communication and a constant appropriate communication.
Thanks. And we are, of course, approaching time, so I might conclude the panel by getting each of you to just leave us with a couple of your top takeaways for the audience around supporting a positive recovery and return to work. And while that's happening, we'll actually throw up a poll question up there, so our audience can also participate in what's your main takeaway from today's webinar as you're giving us your top tips. Kat, do you want to lead back in with?
Yeah, thanks, Andrew. So I've mentioned for employers, as I said, I think get to know your workers before these things happen, establish a positive relationship in the workplace, a positive workplace culture. When people are coming back, make sure that they're coming back to a meaningful role, good work. Regular communication, obviously essential. Identify and manage those psychosocial vulnerabilities for the individual, but also the organisation and other stakeholders. Monitor the workers' well-being and progress, and assess and manage those psychosocial barriers as they arise. Thanks, Andrew.
And Tim?
I guess sum up what we sort of have spoken about. I guess my key takeaways is that return to work support is an excellent investment for the business and the person, obviously. Allowing someone to return to work or recover at work has just insurmountable benefits for the person and also the company. I guess the other one we just touched on is that leaders play a pivotal role in laying those foundations of positive return to work, and just remembering that the leader's role is not to solve or treat employees' health concerns, but to give them that framework to give them the best environment possible to recover within. I guess just quickly finally is that supporting someone with a psychological condition, in our opinion, is in essence really no different than supporting someone with a physical condition. I think that stigma piece that we've spoken to about before, that is just really important to sort of be mindful of in the workplace. But being person-centric, empathetic, empowering, all these principles, regardless of the injury type or causation, gives that person really the best chance to recover and return to work.
Thanks. And some last words from yourself, Peter?
I think from my perspective, I just want everyone to realise or understand that recovery isn't linear. You know, as a psychological claim, if I burnt the toast in the morning on some days, that was the start of my day spiralling down. With my physical claim, you know, I did things that I knew were not helpful. Hanging the washing on the line was not helpful for my back claim. So some days I would have good days on whether it was a psychological or a physical claim. Some days I'd have good days, some days I'd have bad days, and it doesn't necessarily mean it's a huge step backwards, and it doesn't necessarily mean it's people doing the wrong thing. It's just it's life gets in the way of people trying to return to work.
Thank you. So I want to thank all of our presenters. Thank you. Some really profound insights in there. I know I'll have a lot to ponder and percolate away on. Certainly some really interesting ways to be able to reframe. Certainly for me, some of the profound pieces were around understanding the impacts on identity, that empathic early connection, that injury type doesn't matter in the sense of reaching out early and making sure that those connections, that curiosity, showing care and seeking to understand and the importance of being seen and being heard by our workers. I'll just give you a few closing remarks. I can tell you a little bit more about the Rehabilitation Case Management Forum that Mick mentioned in his update. The next forum is going to be on Tuesday the 5th, so coming up very soon. It's going to be focusing on understanding, managing and preventing burnout. It's going to highlight practical strategies to support positive return to work outcome following a diagnosis of burnout, and provide some tools for the audience to recognise and manage burnout in yourself. So if you'd like to register, it's not too late. We've posted the registration link in the chat as well. And I've got one final update to provide on behalf of Comcare's education team. Rehabilitation case management training has recently been revised and updated with the latest content. So there's an opportunity in the last chance for 2023 to get yourself or your team members trained in rehabilitation case management, and that's coming up on the 13th and 14th of December. So you can check out details through Comcare's learning management system. Although spots are filling fast, there's still a couple left, so don't delay if you can. So finally, on behalf of all of us, I really want to say thank you to all of our presenters for giving your time so generously to share your insights. Thanks to the audience, those of you sticking with us, good on you. We really appreciate your feedback. It's your feedback which actually really shapes what we do in future events as well, and helps us know we're on track. So we've got a link to the survey, which you can use via the QR code. It's been posted in the chat. We'll also send you an email about it as well. The recording of the webinar will be available on our website in the coming weeks. So if you've registered, you'll be notified as soon as that is updated. Final reminder, if you do want to stay in touch with the work of Comcare, including any events, guidance and resources, be sure to subscribe to the Comcare e-news or follow us on LinkedIn. And the links are in the chat now. Lastly, thanks for joining us. Have a great day and stay safe.